Time for another edition of Wellness Wednesday with Dr. Bradley Meyer from the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Morning, Dave. Good morning, everybody.
Yeah, and you've got another success story, another hope story, and this one's kind of long distance.
Absolutely. You know, it's every week we're working on getting folks back into balance and better quality of life, and folks that are kind of been spinning their wheels and not making any progress. But Sharon from South Carolina, she's been with us just about a week tomorrow, and you know, her story it's pretty motivating, inspiring, something that it kind of dovetails into my experience when I was in the Air Force. Actually, you know, I saw so many folks that had traumatic brain injury that had been deployed, and they would come back and get imaging scans like MRIs of their brain, and their families would notice they're more irritable, they're not sleeping at night, and something happened to them. You know, they had a blast exposure when they were overseas, and you know, this would have been, you know, around 2005 or so, and these folks, these troops were sent down to Tampa. That's one of the places where they had a big center near MacDill Air Force Base to work on brain trauma and such. The sad story, and I remember so vividly back then, is these folks were basically cast off to say they're crazy. Yeah, and they would run all the tests, and the MRIs would quote unquote come back normal of the brain, and many times these troops were accused of what's called malingering, or, you know, basically making symptoms up for quote-unquote secondary gain, to be medically discharged or put on disability, those kinds of things. And, you know, at that time, these doctors were still grasping for straws of, well, what else can you do besides rest the brain? Mm-hmm. And that is still a pervasive common thread that surprises me that's out there today, because, you know, Sharon, in her story, she is in her early 50s of age and just a sweetheart of a lady, and she was in a motor vehicle collision in February of this year, and the airbag struck the side of her head, and she subsequently has had major changes in the quality of her life. She's developed insomnia, stuttering. She has difficulty getting words out, or what's called aphasia. Her gait and balance are off. Brain fog, really, really severe fatigue, and this so closely matches what I saw in the Air Force. And she as well. She had a full medical workup and MRIs of the brain, and told that those were normal, and basically done the PT/OT, physical therapy, occupational therapy, speech therapy, which are all really, really important, and I agree with those things. But then she was not really given much else for guidance other than saying, just, we got to give it time, and a diagnosis of what's called post-concussion syndrome. And so she, growingly, you know, as we're about 6 months out now, and just completely life-altering for her. She has got 10 children. I think she has 6 children from Ethiopia that she adopted years ago, and now young adults. But just an amazing woman that was, you know, had a catering business, and just sharp as all get out, and she lost her brain tolerance. What happened is, what you get these, it's called coup counter coup, when you have trauma to the brain. It's a fixed, your skull is hard and fixed, and then you've got like jelly, which is the brain inside the skull, And if you take trauma to that skull, it causes that soft tissue or almost jelly-like substance, the brain, to go bounce back and forth. And over and over and over again, and it's almost like little bruising that occurs in the brain. And then there's little, it's microscopic to the point where the imaging, like an MRI, can't typically pick it up unless you look at the MRI differently. So there's a way to do it where you change the gradients and the standard deviations on it, where if you do this for the troops in the past as well, you'll find that their brains almost look like there's little bullet holes or divots in the tissue. And so I suspect that's going to be the way that Sharon's would look like as well. And unfortunately, a lot of the doctors, thought, she was kind of like, well, this is just making it up or in your head type of thing. When no, this is very, very, you can see what's happening once you know, and so she has been here and already seeing some incredible success. She came in walking with a cane, and that is she's put that aside, and her gait is improving. Her brain fog is lifting, and she's having actual periods of time where she's not stuttering, and her speech is fluid and clear, and this kind of is coming and going right now, but where it was constant before. So we're working on healing, helping the body do what it wants to do, which is heal itself through supportive care. And as we always talk about, Dave, in the past about looking at the whole body and the history, things that go back even to digestion for her. She had a history of a gallbladder removal and in years past, and something as simple as even not having a gallbladder can affect what's happening in her detox pathways and how we want to care for her in working on this healing process. Mm-hmm. So what we're doing is it's a compilation of things to reduce inflammation. Of course, the hyperbarics are huge for traumatic brain injury, so that's a big piece of what we're doing. But as we always talk about, lifestyle changes, what is inflaming her? So she's cut out gluten, dairy, which she had previous testing on years past that said she was sensitive to, but very important to completely cut that out for her. Because that's inflammatory, and then we're getting her on some substance, nutraceuticals and supportive supplements that are again working to cool off that brain tissue. One of them is called resveratrol or polyphenols. These are plant-based. And you can see them in green leafy vegetables as well. But that calms down what's called the glial cell activation. So what's happening in her brain is, in anybody that's got brain trauma, is these glial cells get activated, and it causes this constant loop of inflammation. So not only are we knocking that down with hyperbarics, but we're working on doing that with substances like polyphenols, curcumin, which is a spiced turmeric, and working on things like nitric oxide, a product that we use that has improves nitric oxide in the body, which is delivery of oxygen to the brain and decreases inflammation in the body and the brain. And so the culmination of those things, we're sitting down with our functional nutritionist, Molly Avery, and tightening up her nutrition and doing some red light and a multitude of things. We're making baby steps every day. And so just really grateful for the progress we're seeing with her. And, it's a mission for her as well, as she continues to regain her life and her abilities to go back to the way she was prior. It's to talk to the folks that are like her in her shoes, and it may not even be a brain injury. It might be some other chronic condition that's inflammatory, and where they're spinning their wheels and they've had the full traditional workup and we're just kind of stuck. And so that's where we want to kind of work through the stuck and get unstuck and help that body heal. So, again, the stories like hers are very motivating to our whole team here at the Okoboji Wellness Clinic. And it's a blessing to have the folks that come here, and we call it an immersion, and may stay here for a couple of weeks, and they are just kind of working throughout different parts of the clinic as we work on healing and supporting that body's ability to heal, recovery, and it's a beautiful process to be a part of every day.
Yeah, it's really amazing. We have learned so much about inflammation with you over the past few years, and I think the medical community as a whole is as well. And we've talked about gut health. We've seen it firsthand with brain trauma. We've seen it with concussions. This accident, I'm sure, with the airbags being deployed, you have concussions. I'm not sure people realize the absolute crazy force of airbags, but you can see, while very protective, there is a force involved with those airbags.
Absolutely. Yep. That axial force there, can be a shearing force, and and so it's there is a literal physical trauma there that affects things from a pathophysiologic perspective. So there's literally stuff that happens to that brain tissue.
I will say things that I want to get this in here, and we're going to have to delve into this on another Wednesday, but there can't be anything more frustrating for a patient that knows their body, knows the physical symptoms, and then to be told it's all in your head.
No, I can't imagine that. I mean, unfortunately, it's again, we work with the tools that we have and the training that we have, and sometimes the scope needs to be broadened, and many times when we need to widen that lens, and so if it's not fitting into these symptoms into a specific diagnosis code, then we boil it back down to the basics, and how do we support the body and the digestion and such. Even in her case, I mean, her blood sugars have been elevated, and so elevated blood sugars also are a big factor in promoting inflammation. We've talked about that, and especially brain inflammation, so we want to bring that down as well.
All right, we've got to go here, but for people seeking hope, people seeking to peel back the layers of what they've got going on so they can fully embrace and live the day, how can they get a hold of you?
Absolutely. Give us a call at 712-339-6024. We are at 3305 Berquist Avenue in Spirit Lake, just off of Highway 71. And, we're kind of a open book, and just welcome to anybody that wants to stop in and see what we're all about at any time, and we'll be happy to show you around. And also the discovery calls that are complimentary that I do on Wednesday afternoons. It's about a 15-minute phone call, and we discuss a little bit about what's going on with you from a medical perspective, and then we talk about what a course might look like to get you back on track, feeling better, back into balance, so that you're not coming in blind of what to expect on your first visit. We at least have that conversation and get you feeling comfortable about what might be in front of you should you decide to come on and be a part of the team.
Very good. Dr. Meyer, it's always a pleasure, and we'll check in with you again next Wednesday.
Sounds fantastic. Take care, everybody. Be well.
Thank you, Dr. Meyer. Dr. Bradley Meyer, and you can find out more online, OkobojiWellnessClinic.com. Another edition of Wellness Wednesday.